Hi, I'm Jess Cunningham, Australian sports and exercise physiotherapist and author of the book Pop, When Sports Brings Us to Our Knees. You're listening to the Physical Performance Show.
Jess Cunningham, sports and exercise physiotherapist and author of Pop, When Sport Brings Us to Our Knees. Welcome to the Physical Performance Show.
Thanks for having me, Brad.
Well, it's quite uncanny. We are both doing this after hours. It's 1 hour ahead for you, where you are, and you've got 3 young kids put to bed. I'm the same. They're varying ages. But firstly, I just want to say congratulations on what is an outstanding resource for practitioners, surgeons, athletes, of course, with this new book, Pop. So congratulations.
Thank you very much. It's nice for it to be out there.
My gosh, we must start on the how and why this book came to see the surface. But before we do that, a little bit on your background. Jess, you've worked in high-performance sport for many years. You're an APA titled sports and exercise physiotherapist. What fuels the burning desire for you, Jess? How did you get interested in working with athletes in the first place?
I think for me, and potentially like many of us, I was the broken athlete that got sick of being broken and not being able to be fixed, and would like to not have to outsource trying to fix myself. So yeah, I think that planted the seed as I was part of the, initially I'm 6 foot tall. I was a very stubborn gymnast for a long time, an acrobat, but then got scouted as many of us did for the 2000 games, sort of pooling of all of the sports that were going into the Olympics. I got picked sort of as a potential volleyballer, and along with a whole lot of other, I was one of the shorter in the team, but very gangly girls that couldn't play volleyball were trained up to try to make the squad. I made the squad but didn't make the team in the end because I was probably wouldn't have made it anyway. Let's be fair, but I was broken a lot of the time. So yeah, that's probably how it started. And then the Olympics happened. I took a year off and got into physio and thought I'd go and take a year off and come back and really know what I was going to do, and still didn't know. So I did physio because it was there, and haven't looked back. It's been I've loved it as a profession and still do. It's so broad and there's so many things you can do with it and change it with your life along the way. And yeah, it's great.
And many years amongst the winter sports.
Yes. So after doing volleyball, which again, as a sport that I was picked for, that I didn't pick, I guess I've never touched a volleyball since, and that probably says something. But I've always loved sports that connect me to the outside world. So and snowboarded all through my teens and skied since I was about 2. So that's something that I have loved, and then did a little bit of competing with that. But yeah, once I'd finished with volleyball and sort of that aspiring, I guess, to reach the top of that and not getting there and then going into study instead, I just kept traveling with the snow and going, I'd love to combine the two. So spent a bit of time maybe thinking surfing was the thing. It definitely wasn't the beast it is today, as professional as it is now. So quickly realised that winter sports really need their physio because it's like car accidents when they happen. So half-pipe snowboarding was my passion, and spent many years standing at the top or the bottom of a half-pipe, picking people up and putting them back together again. So it's been a lot of fun. Far more interesting for me, I think, to stand in a beautiful mountain than on a football field, but each to their own.
That's fantastic. A bit of the backstory, and Jess, the putting together of Pop, when sport brings us to our knees. What's the genesis story for such a resource? It's quite unique the way you collate and share the lived experience of the athletes or the patients or the people. So yeah, what was the genesis of this?
I've always really liked writing, and there's a backstory that I tapped out of working in professional sport and bought a yacht and sailed across the Pacific and done that for a year and was doing a lot of writing on the boat because there's not a lot else to do apart from stare at the sea and figure out how to sail. So I was really, my writing brain, writing muscle was working a lot, but then I came back and became a mum, so got pregnant, and again knew that working in and travelling with professional sport was not going to be what I was going to be able to do or want to do for the next few years. And I just was sitting, my daughter had been born. This was at the sort of in 2018, 2019, and she was a terrible sleeper. And my brain just doesn't turn off, it turns out. And it just kept at all weird hours of the day. I had so many ideas of so many things and still do. This was just one of the many incarnations sort of that popped into my head at that time. And I thought, what can I do that is still useful with my experiences, that it would be of value. And there's a few in winter sports. ACLs obviously are injured quite a lot, and there's two athletes, Anna and Russ, the two slopestyle skiers who are featured in the book, whose stories, I won't give them away too much, but inspired this. I planted the seed, I guess, and then from there it was like, well, again, research is wonderful, and we need research, but it's a bit dry, and not everybody responds well to that. And if you tell most other athletes or clients about stories of other people doing well, and particularly athletes that they might look up to in a chosen sport or an athlete that they just admire, things go much better than us clinicians getting really excited about the latest research paper findings. They just, no matter how, amazingly convincing they might seem to us, most people sort of just, their eyes roll into the back of the head and they stop listening. So I guess that's sort of how it started, just from sleep deprivation, hours and hours of breastfeeding on the couch, and a writing muscle that thought it could maybe do something of use. But it took me probably about a year of imposter syndrome to sort of get over thinking it was a good idea and actually start pursuing it. And then the arrival of twins along there slowed the last year down pretty significantly, but we got there in the end.
Oh my gosh. Amazing. Well done. And I think you touched on something that is, I think everyone recognizes, and that's the power of story. Certainly as a fellow practitioner like yourself, I think we draw on stories confidentially of people, or sometimes they're in the public domain because it's a sporting star, and it's such a powerful reassurance tool to be able to look someone in the eye and say, hey, look, this person's gone through that and has come out the other side, and you can and will too. So I think it's interesting what you say, that it's such a strong connection point.
Yeah, definitely. And the stories that are included in this book are not, a lot of them are stories that didn't go well. Particularly, there's up to 4 reconstructions that have recurrences that have been there, but they all succeeded in the end, and they all obviously learned a hell of a lot along the way. None of them retired. They all went on to do amazing different things and learn a lot about themselves physically and mentally. And those, everybody going through an ACL or any injury that's a good one and takes you out of what you love to do for quite a long period of time. It's difficult mentally, as well as obviously the physical challenge too. But to have that sort of support network, and I think everyone's like, do a podcast, and I was like, oh, I don't want to do a podcast. People like you can do podcasts. And again, I kind of really liked writing as a medium, and I just wanted to be able to, you're on the couch when you do your knee, whether you do surgery or not. There's a period of downtime, and a book's in your hands, and it's something it just makes you slow down. And I think you consume, we're all on screens so much these days, but with a book and print, you do slow down and read at a different speed and absorb things differently, and you pick it up, put it down. It's a talking point in itself because it's sitting there on your lounge room coffee table, or, gets passed around that way. So it possibly would have been a lot easier had I done a podcast and a bit faster to get out into the world. But we've gone with the book because as far as I was aware, there was and still are, there's nothing else out there like that at the moment. So now there is.
And it's a beautiful design. It's a real eye capturing book cover, and we will have a copy or two floating around the physio clinic that I'm sitting recording this in here on the Gold Coast at Pogo Physio. So if you're in the local area, swing past and have a look at that. Yes. For the YouTube, yes. There it is. There, it's super cool.
Pops in many ways.
Pop, and I believe, Jess, you had the title, pardon the pun, but popped into your head in many ways as the first seed here, right?
Yeah, it was definitely right there on the couch in the early breastfeeding days of once I'd sort of gone, I think, knees and ACLs. Also, if you're going to write a book, again, I actually have another book that I have in mind too, and I thought this would be a great almost practice run, not to discredit this one, but hopefully if I can get over the trauma of creating this one, there'll be another one. Pop seemed like a good name, and then I had a bit of fun getting the tagline and then just running with that. So yeah, the title came in pretty early, and then we had to fill the gaps in after that.
Yeah, no, it's so clever. And the book's broken down into three sections. And part one, Jess, has an introduction. I'm just going to read a snippet out of here. And that is that there's no denying that Australia is a sports-loving nation. We punch above our weight. In skipping down here, but research has shown that in Australia we have the highest rate of anterior cruciate ligament reconstruction in the world. Between 2000 and 2015, a total of 197,557 primary ACL reconstructions were performed in Australia. During this time, the average incidence of ACL increased by 43% and more alarmingly by 75% in those under 25 years of age. Revision surgery also increased by 5.6% per year. Direct hospital costs of ACL surgery in 2014 to 15 were estimated to be $142 million. So can you just expand, Jess, on this ACL problem?
Well, again, going back to the sort of having the title early, it was, if you're going to write a book, you need to write a book that people are going to read. So with stats like that, and I think as most clinicians in Australia, that we're aware of that study that those stats have been coming from. It's a big problem, and it's not just Australia. I think it's Western world. I think that those stats, it's per head, per capita. Obviously, the US has got a much bigger population than we do, but that's a lot happening compared to, obviously the ACL injuries are happening for many reasons. We play lots of sport, football codes, netball, all sports, and playing lots of sport too. This book is definitely, it's not, I've said it before, the Jess Cunningham show. I'm hiding behind stats in that, there's a very small section of stats at the start because, again, most people will just get a bit dry-eyed pretty quickly, and it moves on to the athlete chapters in the middle section really fast. But I think it's just important to set the tone for the general population. Another reason that POP was the title is I'm trying to make stats like that we as clinicians know available to the general public in a way that is somewhat alarming. Well, it is alarming. Look at those numbers, and in a way that they can digest it and read it. So I've kind of got a bit off topic there, but it's a huge problem. I don't have the answers for it all. I don't think any of us do, but there's lots of amazing things out there that are happening, which I try to get to in the end of the book as well, of some resources, all of the injury prevention programs that are out there. Maybe we'll talk about them a little bit more later, but yeah, we have, obviously, prevention's better than a cure. It would be great if we could stop these ACL injuries happening in the first place. And then obviously the ACL reconstruction rates, there's, as again, clinicians, we would all know that there's research, well, it's not new. We've always known that you can survive without an ACL. Maybe in the elite sporting or professional sports realm, it's more traditionally been thought that no, you can't. But, there's a story in the book here, Mitch Short playing rugby union, who's done just that. Some of the skiers, Anna and Russ, Bell in there as well, have all competed at different times with and without their ACL. So their stories are really good as, and they've all gone on to have them reconstructed again. So it's so different for everybody. But yeah, having the surgery versus not, that's a whole nother separate debate. But, in our culture in Australia, we're pretty set up to the MRIs are expedited. It's our healthcare system. You can't complain about it. We're so fortunate. We have such a great healthcare system in Australia, but that is probably such a good healthcare system that we also have quite high rates of reconstruction happening because it's accessible. I don't want to ruffle feathers with that, but it's a big topic. I don't know the answers to all of those questions, but I'm just trying to, I guess, point out some of the information that's there to people that might not already know it.
Yeah, it's opening eyes, fostering conversation. It's cultural, isn't it? Particularly in a country like Australia, I think what happens at the elite level filters down into recreational athletics and athletes and sport. And, we don't look at the football stars of Australia very often, or I can't really recall too many public cases where someone's ruptured an ACL and they've come out and said, well, I'm not going to have surgery. I'm going to rehab conservatively, because there is some evidence that, ACL can heal. We just haven't seen that very often.
No, so that's again, this book is not trying to. It doesn't have an agenda of pushing. For some people, ACL reconstruction is absolutely the best things. It might be, again, for, the winter athletes I mentioned. If you've got the Olympics coming up and you haven't got time to reconstruct it, and you seem to be going okay, well, they did go okay, but they chose to reconstruct it later. So, that's a scenario that might not be relevant at all to someone in the general public. But yeah, it's not pushing an agenda of conservative or surgical. It's just outlining that both of them are there, and these are some experiences. But Mitch's story, I think, is interesting. There's the stats, again, that recent paper that came out at the start of this year, sort of showing that up to 60% of ACLs can spontaneously heal. So again, I'm not trying to push things one way or another with opinions there, but it's pretty interesting. And other parts of Europe and in the world, where their rates are much lower, they do push a more conservative, trial, that 3-month period without going to surgery first. And then, by those stats, it's looking that maybe a lot more people could survive without the surgery. But again, it's what's cultural, it's what's there, it's personal decision, what information is given to you as well, and assumptions. Most of us assume in Australia that you've done your knee, plus if you play sport, you get your MRI and get that surgery done. So if there's no other narrative, of course, that's what you'll go with. So yeah, maybe Mitch's story, again, it's definitely not for everybody, but and the winter athletes do just provide people that have succeeded in other ways, but don't know what the right one is, because it's different for everyone. Then you have to have those. I guess the book is trying to help people to have conversations around this with the right people, with their healthcare professionals. That would be my idea, that they could sit down and go, oh, I've heard this, tell me about this. Oh, I've heard this, tell me about that. So that they're coming in with a little bit more knowledge, rather than just sitting there passively going, okay, great.
Yeah, gosh, so powerful. I know as a clinician, I was fairly tunnel visioned around ACL response in the early half of my career. There was no other option. I wasn't even really aware of a conservative option. And looking back, that's quite challenging to process, knowing what we know now.
Things are always evolving, and it's up to us as clinicians to constantly keep up to date with what's going on. And sometimes we, look back at things we used to do and go, oh, do that anymore.
I'm glad we have improved. Jess, Mitch's story, can you just share a little bit more about that, just for context there?
Yeah, so Mitch plays for rugby union. He was playing for the Waratahs in New South Wales. His sports physician. I've in the book, I have omitted all names of medical professionals involved. So it's the athletes' stories in the athletes' worlds, just to not detract. So his sports physician did have conversations about the conservative versus surgical, and Mitch was quite keen to pursue the conservative. His knee wasn't collapsing or giving way, and his story is just one of those success stories where he actually turned around and in 2 weeks was playing another game again, because of availability within the team. And again, he was passing. So it's not like they just went, oh, let's try. Obviously, he was going through pretty rigorous physical testing that he had to be passing to be doing that was going through all of the support staff with, headed by the sports physician. So, and he was passing all of that. So once the team availability became a bit different and more players came back in, he then stepped back out and had, I think it was around a 3-month sort of proper rehab, and then has continued to play professionally. He's playing in France at the moment. Never had any further issues with his knee. So, so there's and he had a complete rupture. So that's I think, as far as I'm aware, in the professional football codes, I think there's another 1 or 2 in sort of Europe, but in Australian sport, that's the only one that I could really find. That there's one other rugby player that I didn't end up using in the book, but I think who had been playing for a long time without potentially realising that their knee didn't have the ACL, whereas this one was like, oh, I know it's gone, but we're we know we're going down that conservative pathway, and it was successful.
Gosh, it's a great case study, a great example. What do you hear or see or observe, Jess, as being people's fears or pushbacks to even potentially considering a conservative pathway versus the more, I guess you'd say, traditional and accepted option?
I think all of those, and again, it's, that's just one story out of, there's 13 athletes' stories. That's one of 13, and that's probably an overrepresentation of what's really happening out there at the moment anyway. And I'm definitely, but most athletes, well, from my experience in the winter sport, again, the three athletes that are included here, or particularly Anna and Russ, who I helped to get them over the line, they both blew their ACLs. Russ had no functioning ACLs, and Anna had one just a handful of weeks out from the Sochi Winter Olympics. Clearly, that's not ideal, but the Olympics comes around once every 4 years. Again, they managed to pass. Russ had been skiing for a year already without his other ACL, so he already was like, well, I'm functioning fine without that one. And interestingly, he knew of another athlete in, I think it was Norway, who was skiing without his ACL as well. So he sort of had someone to look up to that had made him go, well, why can't that work for me? Because again, had he chosen to reconstruct, he would not have made the Olympics. So I guess but the usual pushbacks would be, what if it fails? Then I still have, there's time frames. And again, that these discussions with elite versus recreational athletes are different. But yeah, some people might not want to wait, or they might not want to have that what if. Whereas if you have surgery, it's like, well, it's done. This is a thing, and I just get on with it. Some people, I think it depends on your belief system, which was what's so interesting about Russ's story, is that he had a role model that he was already going, well, if they can do it, why can't I too? And his scenario was more so, my goodness, the Olympics are here. And again, we managed to get her through, but none of us, that was touch and go. We day by day we took it, and that's just, we had an optimal outcome. She came fourth in the Olympics, interestingly, and Russ managed to come eighth. So it's just so different for everybody. And again, the book's not pushing one agenda either way, but I think that they're just conversations that need to be had, and I think they are happening a lot, probably with most people, but certain knees. Just, Lydia Lucilla in here, her husband has skied for without an ACL. So she was also aware of that, but her knee, for her, that was never an option because it was just collapsing all of the time. So, we don't know who can cope and who can't. That's the magic question. If anybody's got the answers for that, let us know. It'd be nice to have a formula for that.
Oh, wouldn't it? That terminology, Jess, you said, who can cope and who can't. I know, broadly speaking, we sort of made labels, maybe not the right word, but categorize or look for people to be copers, or I guess not coping, non-copers. What would be the alerts that someone isn't coping without going down the surgical pathway? What would you be looking for? What would you advise people to keep an eye out for?
I think, again, depending what concurrent injuries are in the knees, at just a straight ACL, or do you have, meniscal, like looking at that scan to start with, is the posterior lateral corner stuff going on? Do you know that knee is going to be a harder one to stabilize? How they move, if you know the athlete really well, what's their sort of biomechanics? Are they really strong, or are they, and also the demands of their sport, what do they actually need to do with it? But if that, if that knee's just keeping on collapsing and they're having lots of instability issues, at the moment, I think that the best practice they're sort of saying is to do that sort of 3 months of conservative treatment. But then if you look at the research, but that one paper that we have that's saying, I think it was after a year, 50% had healed. There's a big difference between 3 months and waiting a year. So again, there's still no hard and fast answers as to exactly how you navigate that with a client. But I think just education, and obviously letting them decide. Some people might have a very strong preference to not, if given the chance, and some still might be, no, let's get it done.
Yeah, and I think as you are stating and sharing, and the book does a great job of this, as you say, you're not biased one way or the other. It's just opening windows, if you like, of challenging thoughts, beliefs, and just and letting people make an informed decision, but not missing half the story.
That's exactly right. There is no agenda for me. I'm just absolutely fascinated by these stories, and Russ and Anna's stories, particularly for me. I was like, did we do the right thing there? Or, again, they both competed. Russ went on to another Olympic cycle. Anna still skis professionally. They both got to become Olympians. Wonderful. So great for them. But, it was a pretty stressful few weeks. So hair went a definite shade of lighter. But yeah, people just, this book again, you have some downtime, sit there, have a read, or, even as health professionals, I think we can all learn from just reading these stories. And there's thousands of stories. These are just 13 of the many, many, many that there are to choose from, but hopefully written in a way and compiled in a way that just put it all there in plain English to see and make you think and talk.
Think and talk. Jess, Lydia Lucilla, incidentally prior featured performer of the show several years ago, Olympic champion. Lydia's story is so interesting, outlining the tension between, I guess, traditional medical opinion and the gut feel of the athlete. Can you just bring us inside that story, paint a little bit more of a picture on Lydia's case study?
I think, that gut feeling, a few of the other athletes, and I think all athletes or anyone feels it, but maybe athletes are potentially better at listening into it. But yes, a lot of the stories sort of the athletes knew something wasn't right, and Lydia had the brace wasn't working for her at one point in time, and she knew it and she didn't like it, and she sought answers elsewhere, and in the end knew her body well enough to go and find the answers that she needed to, that she wasn't getting from what was in front of her at that point in time. So does that answer that question?
Jess, you've touched on, and you're right about this in POP, about the stories of the psychological burden of such a significant injury, such as an ACL injury, to the athlete or the individual. Can you outline a little around what you've observed over the years with your work on the front line there, with the impact that it does have on the psychology of the athlete? And obviously that goes without saying that we're not just talking about athletes. These are human beings and people.
Exactly. I think, again, whether athlete or not, across the board, anybody that does an ACL injury or any other big injury that takes you out from your sport or just the things that you love, or makes you change the way you live, because you're going to have to rehab, and most people aren't rehabbing on a day-to-day basis. It changes your life. If you aren't able to play your sport and you're an athlete, that's where you get your happy hormones. That's what lights your brain up. So if it's a team sport, or even if it's not, but it plugs you into it's your life. So most of the athletes, all of the athletes, they're talking quite candidly. Adam Gotsis' story is quite a good one about, he's very open about, he went into quite a dark place. But I think all of the athletes featured in the book, everybody ebbs and flows, and you definitely have your down days, and the importance of having support. So I've sort of tried to include, for each of them. Some of them used formal supports, or had access to sports psychologists, or some did have access but chose not to use them. For others, it was maybe friends and family. Whatever it was. Yeah, everybody's version of their support structure is different, but just how important it is to have that around you. And I think there's, that's the power of this book too. It's almost like you've got 13 support structures in a way of, listening to other people and their stories. And there are lots of other, I guess, Instagram sort of things these days. It's much easier to get information out there and plug into stuff. And that's a great tool sometimes too. It's a bit like as a mother's group, they put new mothers together because nobody quite understands what you're going through with a screaming newborn baby until you're actually doing it, and everyone else forgets when they've gone past it because it was so traumatic that you blocked it out. So, putting athletes that are injured together with other athletes that have gone through the same thing is, I think, really, really powerful. But if you don't have a group of athletes or a gym to train in, some of them have also talked about, if they're in a facility like the AIS or the VIS, how great it is to be around other athletes, maybe from different sports or maybe in their own sport that are going through a similar experience. And then Kim Green talks a lot about this as well, about how much better and Cal Ferguson, they were at the end of it, as they matured as their players, of being a better support to other athletes in their teams who then injured themselves, that they had that better empathy and just awareness of what an injured athlete needs, and that all that support structure doesn't just crumble away and you're forgotten about once you've done your knee. So yeah, it's a huge thing. And again, if you're not an athlete, it's still a huge thing. It's a huge thing for anyone.
Yeah, well, it's whether you're athletic or pursuing sport or not, at any level, it's a threat. It's a threat to your well-being and your function and how you show up in the world. And I feel in many ways as practitioners, we're almost more counsellor-like than, physio is obviously, there's so many layers to that, but unless you can identify these psychological burdens, I think the effectiveness of the intervention is always much less.
Yeah, and we're also a huge support that's there because you're seeing them and touching base with them regularly. Obviously as they get on, that might get less frequent, but you need to keep tabs on all of those things. So you're a really important pillar in that support structure.
Jess, before we move off the psychological aspect of injury, and in this specific case, ACL injury, what would be your top tip to athletes out there regarding their psychology with their injury, and then also to practitioners treating the athletes? What would be your top tip to each of those groups?
I think for athletes in particular, and this is, I think we need to be careful, of our language with what we say around athletes, and particularly if you're working in, this is maybe at that very pointy end of high performance sport of, not always being careful. Again, Anna and Russ, historically, you would have thought, we never said that's it, your games are over. If you say that, that's very damaging, and then they believe that too. So again, that's a pretty unique scenario, but I think being careful of the language that you use around, which we should be all the time anyway, and just making sure that you're keeping tabs on people. How are you going? Just like a normal human being. And you're spending, what's the standard appointment time, around 30 minutes or so, but often if they're rehabbing with you, you're with them a lot longer than that. You're having conversation and you're having these relationships with them. So you can tell when things aren't going great, and whether you outsource or do they just need to talk to you, or if they talk to someone else, or can you provide them with another resource like POP, or point them in the right direction of other people that could help them if you're not able to, or they need more than what you can provide.
Yeah, gosh, it's such a great point. And then the power of education, however that occurs, whether it's an audible format, a written format, a conversation, it's so important. Jess,
everyone has a point of how they like to receive information too. So
yeah, it's so true. But everyone likes bright and shiny books, Jess. So POP is going to be for everyone.
Maybe.
Jess, it's been cited that circa up to 50% of all ACL injuries could be preventable. You touched on this. It's in section 3 of the book, Prevention Programs and Strategies. How can you summarize what we're seeing here and what's effective and what people could be aware of?
I think, again, as clinicians or, health professionals, I think we should be, FIFA 11 is probably one of the older injury prevention program that's been around, but, there's now a lot more, and I've provided links to those in the back of the book that are, sports specific. There's the Activate program for rugby. There's the Prep to Play for AFL. There's the Perform Plus, Matt Whalen's great work. I always get that confused in my head, but I'm pretty sure I said that right, Matt, and the kids version of that too. So there's the knee program for netball that's come through. And they're all similar-ish when you look at it. It's a series of exercises that doesn't take all that long. They're just some conditioning, some strength stuff, some plyo stuff, some balance stuff. Apologies to all the researchers who have probably just gone, my God, there's so much more than what you've just said. But, they're a little progressive capsule of exercises that can be formed. And, some of Matt's research has shown they can be done, they don't have to be done at the end of training or the start of the training. Do it at home, just do it regularly. And lo and behold, the training effect, people get stronger and better and you can prevent these ACL injuries from happening. So if we could just get more, I think, again, as clinicians, we're sort of aware of those, but if you go into the general population and down at local club level, no one's doing it, not many. It would be great if a lot more could be doing it. And so I think if POP can achieve one thing, that would be great. Just start to implement these little, put those exercises programs into the people that need to be doing them. That would be fantastic. It's only going to make you perform better. They're exercises. It's good for you.
Where do you think that breaks down, the translation of the evidence, the science into actual, like you say, observation of local club level? Where does it break down? What can be done better apart from POP being proliferated and creating this conversation?
Again, I'm not sure, but there's all that research that's going behind these incredibly smart people doing PhDs on all of this stuff, and we know that it works, and that that the rates that it drops the injury risk down and it's not just for ACLs, it's all lower limb injuries is really significant. Like I think it's 50% reduction or so, and it's even more than that, up to 2/3 in females. So. But is it, what is it? They say 17 years that it takes for research to filter down into clinical practice. Is it that factor? Surely we can do better now we have social media and the power of information can get out much. Books are slow, a slow speed. Social media is pretty fast and powerful. Mainstream media, I don't know the answer, but I think if I was championing one thing with, what's the solution, it's probably that, from especially a physio point of view, to just make people a bit more aware that exists, and let's get those conversations going. And again, there's heaps of great work in and around that, but I think a lot more needs to be done.
And you have certainly contributed to that needed work with POP. Jess, it's been cited that females can be up to 6 times more likely to sustain an ACL injury or a tear than men. Any insight into why that may be the case from your knowledge?
I think, and I think the research, there's a lot of discussion in the last sort of little while about hormonal factors and the menstrual cycle, and again, all these conversations are so fantastic, but you're not going to put everybody on the pill, and the hormonal cycle is a natural thing, and there's no hard and fast evidence yet that you could apply across the board. So I think that that's not necessarily a helpful thing. It's still a bit maybe something, but not something that we can necessarily fix, looking at it from that angle. And then you've got, obviously, females, our anatomy, our hips are a bit wider, where our biomechanics are a little bit different loads and forces around the knees. But again, not going to change the shape of my hips. So it's not, again, something that we can really focus on. But then there's that bigger topic, which I think comes back to this, that we can improve the training. And, historically, the football codes are a great example of this. They've only really just started in the last few years, and that's fantastic, and it's so good. But each time the seasons start for AFLW, there's the casualties that come through for ACLs, and the media has a big, here it happens again, which, because it is happening. But fast forward however many years that's going to take. But, for the male counterparts, they've all been kicking footies around since they were however old to kick a footy around, and, could play club levels, and then, had Auskick, funneling them through. so they've had a lot more experience of all of those movement specific training, better facilities, better exposure, better access, all of those kinds of things. And that's a bigger cultural gendered issue, which again is going to change in those codes. But if we can, and then that gap between female professional sport versus male, if we can start to, again, just provide the girls with more of what the boys are getting, it'll be really interesting. And I suspect that those rates would change and drop. I don't know exactly how, or if anybody does know the answer just yet, but that'll be really interesting to watch over the next few years. But it's not going to do any harm to give a little bit more support for those field, or for all of the sporting events. Give some great training in there, which sort of fits in with those injury prevention programs. Like just prepare the athletes for what they need to do.
Wise words, Jess, and very practical. I'm going to put you under pressure here and see if Jess Cunningham can issue her top 3 tips to someone that's sustained an ACL injury. It's a broad question, I know, and it's not contextualized, but what would be the 3 top tips, Jess, for someone that's just recently incurred an ACL injury? Perhaps they're about to pick up POP and...
Well, POP would obviously get yourself a copy of POP would be one of the tips, whether it's the first or the last. So we've got two to go. I think, and it touched a little bit on this in the back of POP too, of get the right team of people around you. And so usually that's going to be a sports physician or a doctor, probably a surgical opinion at least, and surgery if it goes down that route, and a physiotherapist, and probably towards the end stage, or ideally blending beautifully in there, even from earlier stages, strength and conditioning kind of coach. Some physios will have it just depends on what level you're trying to get back to. And that's another debate in there as well. But ideally you'll have this lovely team. It might be less than that. Maybe you just have a physio and, someone in the medical team too, but just pick the people that work for you. If you're able to, if you're privileged enough to have that choice, and access to be able to do that. Or at least be able to ask them the questions, which again, there's a little bit of a cheat set of questions you should be able to ask and get some answers that satisfy you before you go down the path of whichever way your journey unfolds. That's 2. Then I've got one more.
Get the right team around you, pick up a copy of POP, and the 3rd and final tip, Jess?
And stay positive as much as you will dip up and down, but it's not the end of the world. You will get there. There's many that have gone there before you. And I usually tell my clients, whether athletes or not, that you will be, or particularly with the athletes, you'll be the best version physically of yourself you've ever been once you've completed your ACL rehab, because you have to stop, you have to address what's not working well in your body. You obviously have to get over the surgery or the injury at the start, but then you're going to do the most probably extensive rehab you've ever done. And they do. I think there's a great French study of alpine skiers that, the stats of after ACL, they were a lot more successful than a group that hadn't had it. So, it's obviously not ideal to do your ACL, that's for sure. So please don't do it in the first place. Prepare yourself well. But if you do, you'll just bigger, better and stronger. Do that rehab really well to the end stages and carry on.
Stay positive.
Go forth.
Stay positive. Yep. Fantastic. Yep. 3 tips there, Jess. Every guest of the show issues listeners, Jess, with a physical challenge for the week. So what is Jess Cunningham's physical challenge going to be?
My physical challenge would be, there's so many things that you could do, but my physical challenge would be it's sort of physical, but maybe it's a bit more mental. It's a bit both. But if you ever want to know if you get along with someone really well or not, buy a yacht and go sailing with them across an ocean. See how you go. I think it makes things in life pretty simple once you've succeeded or not in that.
How long did it take you to get across?
You do it. We went from Tahiti to Australia, and it's about 9 months. And you're going with the weather patterns, obviously, to miss the cyclone season. So, but simplifies things beautifully for you.
Well, that's I don't think it'll be repeated on the show. That's amazing. And Jess, a broader question around physical performance as opposed to just the topic of focus for this recording, which has been ACL injury, and that is, if you could boil everything you've learned through your extensive career to date into one piece of advice to help listeners of this show perform at their physical best, what is your top tip or piece of advice going to be, Jess?
Believe in yourself.
Believe in yourself.
If you're not going to, nobody else will.
Wow. You have given us a lot to think about, Jess. Rich and powerful words. Amazing. Amazing. Jess, POP obviously is available wherever you can get books, but anywhere that you would send or direct anyone to that's interested in picking up a copy specifically?
Good old Google is, I think most people get their books online. So if you type in Google, you'll find it, whatever your favourite online bookseller is. If it's not in your library, ask them to get it. If it's not in your local bookstore, ask them to get it if you prefer to walk into a store. If you go to jesscunningham.com.au, there's all the links that could point you there too. So whichever way, but the internet's a wonderful thing that will usually steer you in the right direction.
Yep. We'll pop links up in the show notes as well, but yeah, it is easily found on Google. Pop book probably brings it up. I don't think there's too much.
Pop Jess Cunningham, Pop ACL.
Pop ACL. And Jess, one of the nice initiatives with the book is the contribution that book sales are making to Sporting Chances Foundation. Can you tell us a little bit more about that?
Yes. So the Sporting Chance Foundation, a good friend of mine, Andrew Duff, who we work together in winter sport, has started a foundation that helps aspiring Indigenous Australian athletes receive sports medical care when injured with sporting injuries. So 10% of the proceeds of each book sale will be going towards POP, but I think a bigger thing that we can all do to contribute that to, particularly if you're listening to this as a healthcare provider or in any way, surgeon, sports physician, anyone that's involved in the rehab or care of ACL injuries or any sports medicine injury for that matter. It started with knees, I think, but now it's anything. Reach out to Andrew Duff. Again, maybe this can go sort of in the show notes at sportingchancefoundation.com.au. I think that's it. I have to double check that and get in touch with Andrew Duff of offering your services to if there's an athlete in your area that could need or benefit from some rehab. If you're able to put your hand up and help out, that would be amazing.
What a terrific initiative, Jess. And we absolutely will pop all links in the show notes over at physicalperformanceshow.com. Jess, you're easily found as well, Jess Cunningham Physio over on Instagram. And thank you for stopping by, sharing a little bit about the what, how, and why of POP. And congratulations and thank you for the contribution you're making to the greater good of athletic care and, more importantly, human beings' well-being.
Oh, thank you. And hopefully, again, if it can just help one person through their ACL journey, then I think it's done its job. So I'd love to hear your feedback if you do get to read it. It's been received well so far, but again, just there to be a helpful resource. Hopefully it can be.
Yeah, well done. And thank you, Jess.
Thank you.